Hi YouTube family, welcome back to the Quality Nursing channel. If you are new here, my name is Kwa. I am currently an ICU nurse and soon to be a student registered nurse anesthesia. I got accepted to a program and will start very soon in about 2 months. So I noticed that this is the NCLEX exam season. Many of the student nurses are recently graduated and I know the pressure that you guys are feeling as you guys preparing for the board. I have been there. So in this video today, I want to tackle one of the trickiest part of the NCLEX Next Generations exam, that is the Select or Applied. I will walk you guys through the process of how I evaluate each choices and analyze each questions so that I can come to a confident decision at the end. The questions that I have combined covers topics that are very likely to appear on the NCLEX exam. So let's get your notes ready and get ready to follow along. Alright you guys, SATA, Select or Apply, Next Generation Practice Questions for NCLEX. Let's go ahead and dive straight in. So first questions. A patient is admitted to the hospital with a myocardial infarction, MI. This is also known as heart attack. So it's very important for you guys to know the difference between heart attack and heart failure. You guys should know that by now. And we can go over it a little bit later. And is prescribed a combination of medications. Which of the following statements regarding the prescribed medications are correct? Select or apply. Okay, let's go each question together. A. Aspirin is administered to inhibit platelet aggregations and reduce the risk of clot formations. That's correct. So whenever you guys hear about myocardial infarctions, MI, remember the phrase MONA, M-O-N-A. So we'll usually give the patient morphine to help them with the pain. And then we give them oxygen, put the nasal cannula on the patient, 2-3 liters. And then we're gonna go for the nitroglycerin just to dilate those blood vessels and see if help with the angina, the pain, the chest pain of someone that may have an MI or having severe chest pain. And we suspected them having an MI. And lastly, we're gonna give them the aspirin. And of course, we're gonna do a 12-lead EKG as well to see if it's actually ST elevations or non-ST elevations. Okay, so for me personally, A is correct. So I would choose A in this case because they're asking which following statements regarding the prescribed medications are correct. Yes, aspirin is an anticoagulant and reduce clot formations. All right, move on to B. Morphine sulfate is given to relieve pain and reduce preload on the heart. Correct. Remember MONA, and morphine sulfate is a pain relief medications, and it will reduce the preload on the heart, meaning that it will help with the dilations of the vein that returning the blood to the heart. Less preload, meaning less work for the heart, meaning less pain. C. Triglycerin is used to dilate coronary artery and improve blood flow to the myocardium. Correct. So that's why we give nitroglycerins. We give them to see if it with the dilation of the coronary artery will it help with the pain, and if it does not help, then we're gonna move on to the next phase, which is maybe bring them to cath lab to see if there's any actual blockage based on the EKG result, and or put a stent in the area that was blocked or cabbage. Okay, so C is correct. So far A, B, C is correct to me. And D, clopidogrel Plavix is prescribed to inhibit platelet aggregations and prevent stent thrombosis. So yes, Plavix is often given to prevent stent thrombosis for patients that had stent placed. We usually give Plavix to prevent platelet aggregation. I know that this question, we in our head we think of MONA, we think of so we just morphine, oxygen, nitroglycerin, aspirin. So this question, Plavix, is not correct because it's not related to MI. No, The actual question when you can read is which of the following statements regarding prescribed medications are correct. They're asking for a factual statement. The MIs are just related. The MI are just extra informations. It's not the questions that they want to ask. So you have to treat each answer as true or false. And in this case, Plavix is actual inhibit platelet aggregation. It's an anticoagulant. And it's used for stent thrombosis. So D is also a correct answer. So we have A, B, C, D so far. Next, E, heparin is administered to dissolve existing blood clots in the coronary arteries. That is incorrect because heparin it does not dissolve existing blood clot. Dissolve existing blood clot is thrombolytic, and thrombolytic is TPA. When we give someone who have a stroke, ischemic stroke. So that's definitely not correct. So we will not choose E because heparin is an anticoagulant. Heparin is not a thrombolytic. So heparin have the ability to inhibit platelet from coming together and forming clot, but it does not have the ability to break the clot that already existed. See? Alright, so answer and rationale. So we have A, B, C, D's are correct, and E is incorrect. So we do not choose E. So rationales, I'm going to read them very quickly. Aspirin is commonly prescribed in the acute phase of MI to inhibit platelet aggregation and reduce risk of blood clot inflammations, thus preventing further ischemic events. Correct. Morphine is often administered to patients with MI to relieve pain, anxiety, also reduce preload and hurt by causing venous dilations. Okay, so morphine usually causes venous dilation, whereas nitroglycerins cause arterial dilation, especially coronary arterial. Yes, nitroglycerin usually target, again, it's a vasodilator, primarily dilate coronary arteries, meaning the artery around the heart. Arteries meaning bringing blood, perfusing the heart. So these arteries will be dilate, more blood will come and perfuse the heart, and therefore improve blood flow to the myocardium, and commonly used in the treatment of MI to reduce ischemia and relieve chest pain. Plavix is an antiplatelet medication commonly used in patients with MI who have undergone PCI with stent placements, and it helps to prevent stent thrombosis by inhibiting platelet aggregation. Alright, lastly, heparin is an anticoagulant that prevents the formation of new blood clots. Prevent formation of new blood clots and the growth of existing clots. It does not have the ability to dissolve existing blood clots in the coronary artery. It is used during the acute phase of MI, may vary depending on the patient clinical presentation risk factor and whether they are undergoing reperfusion therapy such as thrombolytic therapeutic PCI. Alright, okay, let's move on to the next questions. I just wanted to give a quick shout out for NCLEX Quizify for sponsoring and partnership with me for this video. NCLEX Quizify is a comprehensive questions bank that covers a wide range of subjects from medical, surgical to pharmacology and even psych, nursing, as well as OB. I have used many of their questions in today's video and have tried their platform for over a week now, and I've got to say it is so organized, and the questions that I've seen on there is actually very related to the experience I had when I took my NCLEX exam. I will show you guys a little bit of their platform right now, and if you guys decided to sign up for the program, use my code QUALITY, KHOALITY, for 20% off. As you can see, their questions are meticulously organized into folders based on each subject, making it incredibly easy for users to navigate and focus on specific area of studies that are clear and have a logical structure. You can also go to your profile main page where you can easily keep track of your answered questions, allowing you to monitor the study progress and identify area needing further review. Let's try one of the free questions that NCLEX Quizify provided. There are different levels of difficulties that you can easily choose from, and they are broken down into different kinds of categories as well. You can also easily hover to the solutions area where we can read the rationales of each right or wrong questions. A patient with hypertension is prescribed medications. Which of the following statements regarding anti-hypertensive medication are correct? Alright, so they're asking for which are the correct statement regarding these anti-high blood pressure medications. Okay, A. Angiotensin converting enzyme ACE inhibitors can cause persistent dry cough. Yes, this is so common. This is like a known fact in nursing school and pharmacology. We know this medication that are ACE inhibitors that are NNPRIL, PRIL, usually comes with dry cough. They come with dry cough. That's their biggest side effect. B. Beta blocker are contraindicated in patients with asthma. This is also correct because beta blocker can exacerbate bronchospasm, the spasm of the bronchioles, and therefore it will further reduce the airway of someone who have asthma. For that reason, beta blockers are contraindicated in patients with asthma, and beta blockers are end in LOL, remember, like labetalol, propranolol, stuff like that. Calcium channel blockers can lead to peripheral edema. Yes, this is also a correct answer. This is just things that we have to know. If you don't know, you don't know. So these things that you have to remember by doing more questions. And don't forget to use my code quality, KHOALITY. Put 20% off. The more practice question you do, the more things you'll remember on your exam, and the more things you'll learn. For example, this calcium channel blocker can lead to peripheral edema, and this is a correct statement. D. Diuretic can increase potassium levels. So diuretic can increase or decrease potassium level, both. We have sparing diuretic and non-sparing diuretic. So if it's a sparing diuretic, when we give to someone a sparing diuretic, we just make them pee out sodiums and water, and they pee, and potassium is spared. So yes, diuretic can increase potassium if they are sparing diuretics. So that's not a wrong answers. So we cannot mark it as not correct, right? So far I've chose A, B, C, D. E. Alpha blockers are commonly prescribed as first-line treatment for hypertension. No, usually if someone have a hypertensive or high blood pressure episode, we usually go for hydralazine first. It's like a vasodilator push, or labetalol, which is a beta blocker if they are not asthma. So definitely alpha blockers are not commonly prescribed at first-line treatment for hypertension. So A, B, C, D is my answers. Are my answers. Yes, that's correct. So let's read the rationale very quickly. ACE inhibitors such as lisinopril are known to cause a persistent dry cough in some patients. Beta blockers like propranolol are contraindicated in patients with asthma due to their potential to exacerbate bronchospasm. Calcium channel blockers such as amlodipine can indeed lead to peripheral edema as a side effect. Diuretic like hydrochlorothiazide potassium sparing can increase potassium level as they cause increased exertion of sodium and water, which can also lead to potassium loss. Can increase potassium level. This called increased excretion of sodium and water. Cross that part out. Yeah, they usually don't. They usually spare the potassium. Alpha blockers are not commonly prescribed at first-line treatment for hypertension. They are more commonly used as a second or third agents due to the side effect profile and the availability of more effective first-line options like ACE inhibitors or ARBs, CCB, or thiazide diuretic. All right, let's move on to the next questions. All right, 3. A nurse is assessing a patient who has been admitted with suspected pneumonia. Pneumonia is basically infections in the lungs. Which of the following findings are consistent with pneumonia? Okay, so sign symptom of pneumonia. A, decreased breath sound in the affected lung area. That's correct, right? So when someone who have pneumonia, they usually have a lot of like infections, a lot of pus, fluid in their alveoli, and that can lead to consolidations of the lung, and the lungs are very dense. And they usually don't have a lot of gas exchange area in the alveoli, so that they have a decreased breath sound when you listen to the lungs. So definitely pneumonia will have a decreased breath sound. Fever and chills, obviously that's a gimme, because if someone having an infection, so obviously their body will react with the fevers, and the patient will be very cold, chilled, even though they are super hot in their core temperature. So A, B's are correct. What about C? Increased tactile phrenitis on palpitations. So tactile phrenitis, this is like a sensation of when you feel on the patient's lung area or the back of the lungs area, when they're talking or breathing, you feel the vibration, and it's just indicated how dense the inside of the lung is, how consolidated the inside of the lungs is. So for that reason, and when it's increased, it is consistent with pneumonia. So this is just another things that you have to note down and learn. Increased tactile phrenitis will lead to pneumonia. All right, next, D, clear breath sounds bilaterally. No, right? They're having an issues. If they have clear breath sound, that means that they have no issues. So that's not correct. So we're choosing A, B, C so far. Let's go next to E, productive cough with purulent sputum. Yes, absolutely. They will have productive cough. What is productive cough? That's meaning cough with secretions. And purulent sputums, or yellowish, whitish, bad, smellish purulent sputum, like secretion, spit. So A, B, C, E. Okay, so remember, when you guys have a select or apply questions, go each questions and treat it as a fact, a true statement, or not. If it's not, then we don't choose it. So A, B, C, E are the correct answer in my opinion, and it's correct. So rationale, pneumonia typically presents with decreased breath sounds in the affected lungs area due to consolidation or inflammations. Fever and chills are commonly symptoms of pneumonia, indicating infectious process. Increased tactile phrenitis on palpitations is a sign of increased density or consolidation in the lung tissues. A productive cough with purulent yellow or green sputums is indicative of an infection such as pneumonia. All right, next questions. A nurse is conducting a health assessment on a patient with suspected heart failure. Which of the following findings are consistent with heart failure? All right, so heart failure, I mentioned earlier, you guys need to know the difference between an MI and heart failure by now. So heart attack or an MI is basically when the heart doesn't get enough perfusions to the heart. There's maybe a blockage that block the flow of blood to the heart and decrease the perfusion, and therefore the patient may experience severe chest pain and may lead to a heart attack. Compared to heart failure is when the heart weaken and the ejection fraction of the heart is decreased. The heart no longer pump effectively anymore and reduce cardiac output to the rest of the body. So the rest of the organs or the bodies does not get enough perfusion because of the malfunction of the heart. So if someone have a heart failure, that means that the heart is weakened and the heart does not pump as good. Basically, that's the difference. So the question here asking, which of the following findings are consistent with heart failure, right? So let's talk with question A bilateral ankle edema. Yes, absolutely. Patient with heart failures always will be edematous because of the backflow of the blood, right? So because of the weakened functions of a heart that failed, when it pumped, there will be some pooling of blood left back in the left ventricle, right? And eventually this pooling blood in the left ventricle will be backed up into the lungs, and not only causing lung issues and also causing back up to the right ventricle and eventually to the rest of the body. So that's why you guys will see patient with heart failure that will be very edematous, and it's like +3, +4 edematous in severe cases. So bilateral ankle edema is definitely consistent with heart failure. B, decreased blood pressures. So this can be correct, but in the earlier stage of someone who we are suspecting heart failure, their blood pressure usually increase as a compensation mechanism of the body. The body will try to make the arteries more rigid so that there's more force for the perfusion of the blood to the rest of the body and to the organs. So in later stages, when the patient has severe heart failure, then the blood pressure will decrease. With someone who we are conducting a health assessment and the patient is only suspected of having heart failure, decreased blood pressure is not an answer consistent with heart failure at the moment. So usually heart failure will cause backup of fluid, of the pooling of blood. So B is not the correct answer. Next, C, crackles in the lungs. This is correct. Like I mentioned earlier, the contraction of the heart is weak, therefore there's blood pooling in the left ventricles, and therefore will be backed up into the lungs and causing fluid in the lungs and crackle in the lungs. That's consistent with heart failure. The jugular venous distension, yes, when you have backup of the blood from the lungs, from the left ventricle to the lungs, and then to the right ventricles, and to the rest, back to the rest of the body, it will go through the jugular venous vein, because that's the vein that brings blood back to the right ventricle. So it will causes the vein, jugular vein will be distended, and you will see it. So A, C, D's are consistent with heart failure so far. E, elevated serum potassium level. Okay, so I know that I have been in your position. If I were a nursing student, and I would definitely think, oh my god, heart failure, there's not enough perfusion to the kidney, therefore kidney will be malfunction. And what is the job of the kidney? Excrete potassium. And what if the kidney doesn't get good perfusion? It's malfunction, so it will cause elevation of potassium level. That's not wrong to think. However, when you guys doing the exam in NCLEX, you guys have to not go in your head and go that far. If you have to go that far, if you have to go and go to the next step and the next step and the next step, that's not the correct way to treat an NCLEX exam. They asked about heart failure. They did not ask about kidney failure. If they asked about kidney failure, elevated serum potassium will be correct. But because they asked an early stage suspected heart failure, elevated serum potassium is not the correct answers. Alright, so it's not correct in this question. So A, C, D's are the correct answers. Yes. So rationale, bilateral ankle edema is common signs of fluid retention in the heart failure due to impaired cardiac function. Crackles in the lungs often hurt on auscultation, indicate pulmonary congestion secondary to heart failure. Jugular venous distension (JVD) occurs when there's an increase in central venous pressure (CVP), often seen in patients with heart failure. All right, number 5. A patient is admitted with suspected deep vein thrombosis (DVT). Okay, usually ICU patient or patient in the hospital, when they stay on the bed too long, they can develop DVT, basically a clot form from the legs and can travel up to the lung and cause a PE. So which of the following interventions are appropriate for managing DVT? So, alright, so we know what's DVT are now. So A, administering low molecular weight heparin. Low molecular weight heparins are like enoxaparins, Lovenox. So yes, that's like a common ICU bundles that we usually order for patients, and definitely it is one of the intervention that is appropriate for managing DVT. So A is correct answers. By the way, quick quiz. If you guys want to comment down below, what is the correct way to administer enoxaparin, Lovenox? Comment down below and let me know. I want to know what labs are we looking for and the area of the body that we are administering the Lovenox. Let me know down below. Comment down below. Anyway, B, applying warm compresses to the affected extremities. That's not really necessary. Applying warm compresses to the affected extremity, I wouldn't recommend it. I've never heard of it. Usually warmness can cause vasorestriction of the vein or the artery. So for that reason, I wouldn't recommend giving someone who have DVT warm compresses because it can further obstruct the perfusions. So B is not a correct answer. C, initiating warfarin therapy immediately. Warfarin takes so long to reach therapeutic, so it's not something that we use as interventions for someone to manage DVT. No. D, elevating affected extremity. Yes, definitely. When someone who are suspected of DVT, definitely elevate the affected extremity, whether it's their legs or the arms. We elevated the affected extremity to promote the return of venous blood, so that increased perfusions and so that it increased the return of blood and therefore reduce the risk of developing more clots. E, administering out-of-place TPA for thrombolysis. No, absolutely not. TPA only give for patients that are having ischemic stroke. Before we give TPA, we have to bring them to a CT scan, a CAT scan of the brain to make sure that there's no brain bleed or brain hemorrhage, because TPA is associated with high risk for bleeding in the brain. So definitely no TPA to treat DVT. Usually we give to treat a established existing DVT. We usually can go and there's two procedures. We can put a filter in the heart, and the next is thrombolytic. Yeah, it's like a procedure, thrombolytic, where they come in and they remove the clots. All right, so A and D's are correct. Rationale: low molecular weight heparin enoxaparin is commonly used for the initial treatment of DVT due to its predictable anticoagulant effect and lower risk of bleeding. Elevating the effective extremity help promote venous return and reduce edema, but does not directly treat the clot. Warfarin therapy is typically not initiated immediately for DVT management due to its low onset of actions. TPA is a thrombolytic agent and used for the treatment of acute ischemic stroke and massive pulmonary embolism, but it is not typically used in the routine management of DVT due to the risk of bleeding. 6. A nurse is providing education to a patient's prescribed levothyroxine synthroid for hypothyroidism. Alright, so levothyroxine synthroid for hypothyroidism. Which of the following instructions should be included? So another pharmacology questions. These questions you guys have to know, and the only way to know that is to do more practice questions. Alright. So A, take the medication on an empty stomach at least 30 minutes before breakfast. Yes, yes, and yes, absolutely. Levothyroxine is so important to be taken on an empty stomach because we need to promote the absorption of the medication. I remember in the ICU we always give it like 6 because the food come at 7. So we usually give the levothyroxine before breakfast. Okay. B, avoid consuming calcium or iron supplement within 4 hours of taking levothyroxine. That's true. Usually we don't give calcium or iron supplement with any other medication either because of the potential of interference of the medication. So definitely A and B are correct. Monitor for signs of hyperthyroidism such as tachycardia and weight loss. I would say that's not incorrect, but we would monitor for signs of both hyper and hypothyroidism. So C may not be correct, but we will come back to that answer. D, notify the healthcare provider if experiencing symptoms of hypothyroidism such as fatigue and weight gain. Okay, so I would choose C and D both, right? D is definitely correct because we need to notify the healthcare provider if experiencing symptoms of hypothyroidism such as fatigue and weight gain, because if the medication doses are not enough, then the healthcare provider can increase the dose because the patient is still experiencing hypothyroidism. So D is definitely correct. So A, B, and D. So I don't think C is correct because the patient is having hypothyroidism. What about E? Levothyroxine may interact with certain medication, including antidepressants and antacids. Correct. So E is also correct answer. So my answer choices are A, B, D, E. Yes. But I also think that she should be correct because what if the dose is too high? Right? It can lead to hypothyroidism. But apparently that's really not a thing. So if the question say that the patient have hypothyroidism and taking levothyroxine, so we don't need to monitor for hyperthyroidism. Yeah. Rationale: taking levothyroxine on an empty stomach ensures optimal absorption as food can interfere with its absorption. Calcium or iron supplements should be separated from levothyroxine by at least 4 hours to prevent impaired absorption. Patients should be educated to recognize symptoms of both hypothyroidism and hyperthyroidism and to report them promptly to their healthcare provider. Levothyroxines may interact with various medications, including antidepressant and antacids, altering its absorption and efficacies. Okay. So C is incorrect because we should teach the patient to monitor for both hyper and hypo. The question C is only teach one, so that's why it's incorrect. The patient should be educated to monitor for signs of hypothyroidism and hyperthyroidism as they being treated for hypothyroidism with levothyroxine. Signs of hypothyroidism include fatigue, weight gain, cold intolerance, constipation, dry skin. Hypothyroidism present with symptoms such as tachycardia, weight loss, heat intolerance, tremors, and diarrhea. Okay, so it's just not a really good worded questions, but in my opinion, yeah. So in order for C to be correct answers, they have to monitor for both hyper and hypothyroidism sign symptom. All right, next question. The nurse is admitting a client with hypoglycemia. Identify the signs and symptoms the nurse should expect and select or apply. So this is also important, you guys. This is like easy question that you guys must get in order to pass the exam. So we learn so much about all the hard things, but we forget about the basic stuff. So know hyperglycemia and hypoglycemia sign symptom because it's so common in the hospital even. So please know this sign. So hypoglycemia, number one, thirst. Absolutely not. Thirst comes with high blood sugar. When we eat something that very sugar, we usually get very thirsty. So definitely thirst is not an expected sign for hypoglycemia. So no. Number two, palpitation. Yes, when someone have hypoglycemia, the body usually trigger the sympathetic nervous system, and that therefore there's hormones that being released, like adrenaline hormone that will be released and cause palpitation and sweating. So that's why patient with hypoglycemia will have palpitations, and 2 is correct. 3, diaphoresis. Yes, diaphoresis is sweating, so definitely 2 and 3. Slurred speech. Yes, absolutely. Someone who have hypoglycemia can also have slurred speech because the brain use glucose to function, and if we don't have enough glucose, the CNS will be depressed, central nervous system will be depressed, and therefore slurred speech. So 4 is correct. Hyperventilation. No, hyperventilation usually occur in patients with high blood sugar level, maybe in DKA or something like that, and need to blow off the excess acid or excess CO2, and therefore they're hyperventilating. So 2, 3, and 4 are correct. Yes. Rationale. Palpitation, an adrenergic symptom, occur as the glucose level falls. The sympathetic nervous system is activated and epinephrine and norepinephrine are secreted, causing this response. Diaphoresis, a sympathetic nervous system response that occurs as epinephrine and norepinephrine are released. Slur speech is a neuroglycopenic symptom. As the brain receives insufficient glucose, the activity of CNS becomes depressed. All right, next question. Which adaptation should the nurse caring for a client with DKA, diabetic ketoacidosis, expect the client to exhibit? Select to apply. So diabetic ketoacidosis, I've gone over this many times over in my channel, so I'll link it somewhere below or above. And it's also so common in the hospital and ICU as well, you guys. So we have to know what this client exhibit. So DKA is basically type 1 diabetic patients that have very high blood sugars level, and but because they don't have the insulin to process those sugars into energy, the insulin instead uses their fat and metabolize their fat into to use for energies, and in the process of metabolize these fat for energy, it have a waste products known as ketones, and the build up of the ketones in the blood of the patient that have DKA commonly leads to low pH level, meaning acidic blood, and also fruity, malodorous breath. Yeah. All right. So select to apply. Number 1, sweating. No, they usually don't sweat because they're very dry. High blood sugar usually causes the body to be very dried. Yeah, so no sweating. Remember, sweating is diaphoresis, and diaphoresis are commonly happen in patients with hypoglycemia. All right, number 2, low PCO2. Low PCO2 meaning low carbon dioxide. This is correct because they usually hyperventilating. This patient has a because their pH level is so acidic, the blood pH level is so acidic due to the buildup of the ketones level. So for that reason, the body mechanism is to breathe out as fast and as much as possible the carbon dioxide. So therefore, they will have low PSO2. Retinopathy. No, because it's nothing. Usually they are like in diabetic type 2 high blood sugar that causes issue with the eyes, but at the moment retinopathy is not directly related to the DKA at the moment, so I will not choose retinopathy. For acetone breath, definitely acetone breath, fruity breath, malodorous breath are common because the body has a buildup of the ketones. So yes, that's another hallmark of DKA. So 2 and 4 at the moment. 5, elevated serum bicarbonate. No, this is wrong. Elevated serum bicarbonate is not correct. So I understand that you guys may think, oh, because the pH level is so low and it's so acidic, the body may release more bicarbonate to buffer and neutralize it and bring the pH up. In this case, it's not correct. So that's the way of thinking is correct, but serum bicarbonate, because the body has so much ketones and the job of the bicarbonate is to neutralize acidic. So because of the so much ketone buildup, it decreases the bicarbonate level in the body because it uses up all of the bicarbonate of the body for the neutralization of the ketones. So for that reason, the elevated serum bicarbonate is not a correct answer. So I'm choosing 2 and 4. Yes. All right. Metabolic acidosis initiate respiratory compensation in the form of Kussmaul respiration to counteract the effect of ketone buildup. Kussmaul are rapid and shallow breathing, so like that, resulting in a lower PCO2. A fruity odor to the breath. Acetone breath occurs when the ketones level is elevated in ketoacidosis. All right, last questions. Hang in there, you guys. I know you guys got this. Which of the following nursing diagnosis would be appropriate for a client with heart failure? All right, again, heart failure again. So heart failure is a weak heart malfunction that's not pumping effectively. Okay, so we're choosing which one is appropriate nursing diagnosis for this. Oh, it's been a long time. All right, question number 1, ineffective tissue perfusion related to decreased peripheral blood flow secondary to decreased cardiac output. Well, that was a mouthful, I don't understand. Ineffective tissue perfusion. Correct. So when someone had heart failure, the heart doesn't pump enough blood, so there is a ineffective tissue perfusion. Correct. Related to decreased peripheral blood flow. Decreased peripheral blood flow, that's also correct, because there's a decrease in cardiac output and less blood coming to the organs and the tissues of the body. So decreased peripheral blood flow, correct. Secondary to decreased cardiac output, correct. So number 1 is correct. Number 2, activity intolerance related to increased cardiac output. Activity intolerance, correct, because usually patients have heart failure, their activity is impaired. However, related to increased cardiac output, no. It have to be completely correct. Someone with heart failure cannot have an increased cardiac output. That doesn't make sense. The heart is weak, the heart gonna pump out more. So number 2 is incorrect. If it were to be activity intolerance related to a decrease in cardiac output, then that will be a correct answer. But no, this is not a correct. So 1 is correct only for the moment. Number 3, decreased cardiac output related to structural and functional changes. Ooh. Decreased cardiac related structural and functional changes. Correct. The function of the heart is impaired, so cardiac output is decreased. So I agree. So 1 and 3 at the moment. Number 4, impaired gas exchange related to decreased sympathetic nervous system activities. Impaired gas exchange, correct, because of the backup of the blood flow. But related to decreased sympathetic nervous system activity, that's not correct. Usually in heart failure patient, there will be an increase in sympathetic nervous system activities, because remember, the body tried to compensate by making restricting the arteries, so that the force, the pressures of the blood that perfusing the tissue can be increased, so that more blood can be perfusing the rest of the body. So it's an increase in sympathetic nervous system, not a decrease. So 1 and 3 is not correct. Yes, 1 and 3. Heart failure is a result of structural and functional abnormalities of the heart tissue muscles. The heart muscle becomes weak and does not adequately pump the blood out of the chambers. As a result, blood pools in the left ventricles and back up into the left atrium and eventually into the lungs. Therefore, greater amounts of blood remains in the ventricles after contractions, thereby decreasing cardiac output. In addition, this pooling leads to thrombus formation and effective tissue perfusion because of the decrease in blood flow to the other organs and tissues of the body. Typically, these clients have an ejection fraction of less than 50% and poorly tolerated activities. Activity intolerance is related to a decrease, not an increase in cardiac output. Gas exchange is impaired, however, the decrease in cardiac output triggers compensatory mechanism, such as an increase in sympathetic nervous system activities. Alright, thank you so much, you guys, for making it here to the end. I appreciate it so much.